What if brushing your teeth was not just about your smile, but your brain, your heart, and your gut? Today on WellWaveNOW, we welcome Heather Paul to the show, and she's going to show us how oral health is the front line of whole body wellness. Welcome to WellWaveNOW, your portal for actual wellness insights. We, Brett Rice, Dr. Bob Levine, and Tim Daniels, myself, are your wellness catalysts committed to elevating your health, enhancing your functionality, and optimizing your performance at every life stage. WellWaveNOW, where timeless wisdom lights your wellness path. So again, we're going to welcome Heather Paul here. She spent nearly 3 decades transforming smiles and lives, but she's not your average hygienist. She's certified in biological dental hygiene, trained in myofunctional therapy, and Heather integrates airway health, microbiome science, and whole body wellness into every conversation about oral care. As a national speaker, educator, and founder of Simply Silver Mouthwash, she empowers people to rethink what dental health really means. Heather, welcome to WellWaveNOW.
Hi, thanks so much for having me today.
Yeah, Heather, it's great to have you on the show. And you haven't had the typical experience, and so that's why we're excited to talk to you. And let's get started with maybe what was most eye-opening to you that you felt like, man, I didn't learn this in school. I didn't learn about this when I was learning about oral hygiene. And we'll start with that. So, what was that one thing that started you questioning? Should we be doing something more?
Well, I would say that, in school, you're just kind of conditioned into the mainstream thought that fluoride is God's gift to dentistry, right? That if someone is having constant cavity issues, you just give them prescription fluoride and that's going to solve everything. Even topically or ingesting it, anything extra gets stored in your bones. Isn't that wonderful? But as I was practicing, despite all of the fluoride that we prescribe people were still getting cavities every single time I see them. I'm like, well, this doesn't make sense. So what is the root cause? And I think that just really started me on this rabbit trail of looking at the mouth instead of just a compartment, about a holistic picture, that there has to be a reason as to why someone is continually getting decay, which, by the way, dental decay is the #1 disease in the world. So I think it's just kind of making that shift as to, it's not a fluoride issue. If you get a cavity, it's not from a lack of fluoride. There's no such thing on the planet as a fluoride deficiency. And that's because it's not an essential nutrient that's needed for your body. So I was frustrated in that I couldn't get my patients to stop having cavities.
Well, hold on. Well, I don't want to assume that everybody knows what the dental disease really is. So kind of define that, Heather, if you would, please.
So dental decay is a cavity, right? People usually fall into the category of either they're cavity prone, dental decay, or have more gum disease issues. But again, in dentistry, we're so focused on just the compartment of the mouth that you're not looking at the systemic part as to if there is a root cause as to why that patient is either dealing with dental decay or gum disease. There is something lacking in the body that we need to address, and not just mask the symptoms with chemicals. I mean,
And what is gum disease, Heather?
so gum disease, it starts out as inflammation, right? Inflammation of the gums is called gingivitis. That's completely reversible. What's holding your teeth in place is your jaw bone, right? So when the gums get inflamed, we need to address that. That's a major warning sign. Anytime your gums bleed, either when brushing or flossing, that's not normal. It might be common, but it isn't normal. It's a warning sign. But if left untreated, that inflammation can actually create disease of the bone. So that goes from gingivitis, which is reversible inflammation, to periodontitis or periodontal disease. And that's disease of the bone when your bone is rotting. Now, people wait too long in dentistry because they assume that, well, if I have a cavity, it would hurt, or if I have gum disease, it would hurt. But the problem is things don't hurt until it's too late. Like, you're never going to know that you have a cavity when it's in the enamel, when you can actually do something about it because your enamel has no feeling. You'll never know that you have gum disease until it's too late because your bone has no nerves. But the signs and symptoms are there, which is why you don't want to ignore the signs and symptoms of bleeding gums, sometimes a bad taste or odor in the mouth. So it's all about prevention in dentistry.
Okay, good. So you got that. So you had that one connection where you said, look, you're looking for the root cause of what caused the cavities and decay, but then you also came to the conclusion that, and understanding, I would say, because I don't yeah, I don't think don't want to imply you dreamed it up. So, but you came to the understanding that there was the other direction, that oral care and cavities and gum disease and mouth care is connected to whole body health. So when did you realize that, and what is that overarching connection?
Well, I mean, they've kind of known the relationship between the mouth and the heart for quite some time, but more and more research has been done as to what else does it do. I mean, there's no fence in your body, right? If you have a disease in your mouth, there's not a fence that separates it from getting into the rest of your body. And we need to stop looking at it as teeth as some sort of like non-important object. It's an organ, and it's connected to other organs in your body. Everything is connected. So, the heart and the mouth are directly connected. That if you were to give someone a nitroglycerin tablet, it bypasses the GI tract and goes directly to the heart. Well, that bacteria can too, if you clog your arteries. And now they're doing more research on bacteria in the mouth, the PG bacteria, which the word is like this long. When you're over the threshold of that bacteria, can actually cause Alzheimer's. So now we have more diagnostic testing available. It's the Hain test, HAIN, or the oral DNA test, which I offer the oral DNA test on my website. And what that does is it will show if you have some of the markers that cause periodontal disease or gum disease. There's 11 bugs, right, that can cause that disease. So this test will determine if you have one, if you have two, if you have all 11 above the normal threshold. And then it helps you treat that root cause more efficiently because now you know what you're testing positive for. So I think getting to the root cause, finding out, is it bacteria related? Is it MTHFR mutation related? Is it, some other issue that we need to address rather than just telling someone you just need to use fluoride toothpaste?
Now, Heather, are these a lot of experiences, or was there one particular patient or experience that really gave you the shift in mindset to that it needed to be more?
Say in 2010, my husband, he had gotten a root canal in 2000, I believe. It was on number 30, which is that first molar on the lower right. And his lymph gland would blow up. And this kept happening. I took an x-ray of the tooth, just kind of thinking, I wonder if it has anything to do with that root canal tooth. But the x-ray, the 2D image, didn't show anything. But you know how you have a gut feeling, right? So I'm like, what do you think? It's this root canal tooth. So I started researching root canal teeth, and I was really shocked. I've been practicing for over 10 years at that time. And I just could not believe I had been such a promoter of get a root canal when this is the only profession that we actually leave something dead in the body. It doesn't even make any logical sense. So every single root canal tooth has endotoxins. So once I took my husband to a biological dentist, he did what's called a cone beam x-ray. And it's way more diagnostic than a 2D x-ray. So there was, in fact, infection in his bone. And when they got in there to do the extraction properly, he said it looked like black oil was down in his bone. They immediately sent him to get an IV to clean his blood. And, once that infected tooth was removed, he never had that issue with his lymph gland blowing up. So that really opened up Pandora's box for me because, in my profession, the standard of care is when there's something wrong with a tooth, you get a root canal. And, root canals, if they last 8 years, are considered successful. But I can't tell you in 30 years of practicing how often they fail. And it's just against the body's design to leave something dead in your body because you remove the blood supply, you remove the nerve. And the reason why that tooth has to now have a crown is because it'll turn black. So, I do want people to understand you do have options. You don't have to get a root canal. And at what expense do you want to leave a tooth there? Your health? I mean, you don't know what your immune system can or cannot handle.
Okay. So you talked about that thing. You kind of pointed out two things so far. Yeah, we'll have to debate the fluoride thing a little bit, but you kind of debated two things that are considered kind of standard dentistry, the fluoride and the root canal. What else, and are there anything else you say, here's kind of the standard of care that through your knowledge, and you're looking for the whole body connection, whole body health and oral health in general. Are you saying, or maybe we ought to question these as well? Anything else come to mind for you?
Well, also the fact that people have been living with mercury fillings in their mouth. I mean, when mercury is one of the most toxic substances known to man, many people have mercury fillings in their mouth. And they're not silver. I mean, they're called silver fillings, but by weight, they're 52% mercury. So I think, people that have mercury fillings in their mouth need to really address that issue. Um, you know, so many people are dealing with underlying health issues and can't seem to figure out what the root cause is. I think you go to your medical doctor and you get all these battery of medical tests, but does your medical doctor even ask you, when was the last time you had your teeth cleaned? What are your oral habits like at home? What's your diet like? Instead, it's just, prescriptions for symptoms and never getting to the root cause. I like working with holistic dentistry because it looks at the whole picture instead of just the mouth being a compartment.
I was going for a colonoscopy, and the nurse there was checking getting prepared for that. She mentioned, "Oh, she gave the name of my primary care doctor," and she said, "You need to keep her. She's really good." So now, why did I tell that story? Because she does ask me when I go in each year, have one of you had your eyes checked? When's the last time you saw your dentist? When do you do that? And that's one of the reasons I go to her, and I screened her out at first because I wanted someone who was I wouldn't necessarily put her as holistic, because sometimes I consider holistic the wood nips, but I would say she's integrative, and she does look at the whole body. So I encourage people to do that, and and as you said, the dentist should actually do the same thing about that connection. So,
well, being in the dental field, we have an advantage that medical practitioners don't have, and that is in a couple of minutes we can determine disease very simply. And I think that that really does get overlooked. People think that they eat clean and exercise and they're healthy, but 100 million Americans don't go to the dentist every year, nor do they brush their teeth twice a day. And what's the number one killer in America? It's cardiovascular disease. So we clearly have an issue in America. And I think even 50% of Americans have some form of gum disease. So
and so you mentioned earlier, we've known the heart mouth connection for a long time. I think you've known the heart mouth connection for a long time. I don't think the general public does either. So I will say, even now, this getting to be a little old, but I'm going to say this is probably when we were raising our kids together, so maybe probably 14 years ago. But I had a cardiologist that lived across the street from me. He said, "I haven't been to the dentist," and I said, "Look, there are things. Aren't there connections between the heart and the mouth?" He said, "Well, I don't have any of those things." So, and he was a very good cardiologist. So tell us a little bit more. You talked a little bit about how bacteria can go directly from the mouth to the heart, but tell us a little bit more about how it, that oral care affects cardiovascular disease, and what are the other things that because I will ask, and I wasn't. I will say my dentist even asked me one time, "Well, are you diabetic? What do you think going on?" And I said, "No, we went and checked." And all that. But what other? You mentioned you could also spot the other diseases pretty quickly, and so. Tell us a little bit more about that, because I think we really have to drive home to people that for their kids and for themselves, that it's not just about pretty clean white teeth with this oral care.
Exactly. Well, our mouth has an oral microbiome. It's like a mini immune system. Everything starts right here. This is where digestion starts. Everything is in the mouth, and you've got one tube. It starts here and it goes all the way out you, right? So if you have a disease in your mouth, like I said earlier, there's not a fence that stops that from getting into your other organs. Your teeth have meridian points. So everything is connected. If someone might have an issue with digestion, I would say, what's going on with a tooth that's actually linked to that, and start there. But the immune system of the mouth, the oral microbiome, is a very delicate balance. There's like 800 different bacteria in our mouth, both good and bad. And this, like I said, is a mini immune system related to our gut health. So when we use products such as fluoride actually disrupts the oral microbiome of your mouth. When you use an alcohol-based mouthwash, that really disrupts the oral microbiome of your mouth. What you want to do is you want to create a healthy balance of good and bad bacteria. But when you use a broad spectrum antibiotic like hydrogen peroxide or alcohol, you're wiping out the good bugs, which will make the bad bugs flourish. And then that drops the pH. So I want you to think about your mouth as being this important balance where everything should be more neutral, right? Instead of too acidic. Because if your saliva drops below 5.5, that's how you can get a cavity. So it's the acids. When you have something acidic or plaque in general, right? Plaque, which is part of everyone's saliva, by the way, plus sugar form an acid. So when your home care isn't good and you're not removing the bacteria from between your teeth, and then you're drinking something acidic or eating something that's turning into an acid, and acid upon acid is what's creating dental decay or cavities. When you use alcohol-based mouthwash, that's dropping your pH because the average pH of your commercial products is like a 4.2. So you're squishing with acid. So everything basically on our commercial shelves today is going to disrupt your oral microbiome, going to disrupt your pH. So you need to understand what you need to do to balance that, raise the alkalinity, and obviously have good home care habits. But it's not a fluoride issue. It's really just understanding how you can balance that oral microbiome so it's helping your body and your digestive system at the same time.
Do they make a little stick like you dip in your pool to check your balance that you can put in your mouth?
Yeah.
Okay.
Mm-hmm.
Wow. So somebody could test that at home, then not even have to get a lab test on that. We've talked a lot about tying into, the heart health, obviously, and that's the number one thing that we focused on, hey, it could start in your mouth, and you alluded to that there could also be, and there certainly is a connection with your gut biome as well, right? What about brain fog? Where's that connection?
Well, I think, and this is why I mentioned mercury fillings earlier, a lot of people that have, say, brain fog or sometimes tremors, all different kinds of heavy metals like toxicity can actually be stemming from the mercury fillings inside their mouth. I mean, think about how close it is to your brain. It's going to cross that blood-brain barrier. So you don't want to just go and tell a regular dentist, I want all of my amalgam fillings removed, because you're going to be drilling out way more mercury while they, remove it. So that's why it's so important to go to a mercury safe dentist, not just a mercury-free dentist. But I would say if someone's struggling with brain fog, do you have mercury fillings? That would be my first question. Also, a good chewable probiotic is beneficial with just reestablishing that oral microbiome. That's important. But I think a lot of the brain fog can come either from parasite-related or heavy metals.
Now, you said something there. You said, I thought I heard you say there's a mercury safe and a mercury free dentist. So now, Heather, what's the difference between those two? Come on.
So I go into depth in my book, Dentistry Made Easy. It's basically a consumer's guide for everything dental related. I'm very passionate about getting people to feel more empowered, because I see it all the time. They see somebody in a white coat, they freeze, they're afraid to go to the dentist, they don't know what questions to ask. But I do talk about mercury. I have a whole chapter of it in my book. So someone that says they're mercury free just means that they don't do mercury. Well, most dentists don't do mercury anymore. A mercury safe dentist is going to be having the equipment needed to remove that mercury vapor from the air. You're not going to smell it. I mean, it's an odorless vapor that once it's in the air is exposing you to so much of that mercury and can make you more sick. So I would say if you're somebody that is immunocompromised, you're dealing with brain fog, you have other signs of heavy metal issues, go to a mercury safe dentist, because then they will remove that properly. They have all of the protocols, the right HEPA filters. They'll put a rubber dam in your mouth. They have the suctions, everything needed so that you're not exposed further to mercury poisoning.
Yeah. You touched on earlier a statistic that was a very large number of people that don't go to get their, even annually. You should be going every 6 months, but someone that won't go to the dentist even on an annual basis. What was that number again?
100 million Americans don't brush their teeth twice a day, nor do they go to the dentist.
Go to the dentist. So is it that fear of, having somebody's hands in your mouth and the pain of it and all of that? Because I mean, I know I do my every 6 months, but it is a painful chore for me personally.
Well, it's kind of like if someone is more cavity prone and you don't really have gum disease issues, twice a year is okay. But if you're somebody that really struggles with gum disease, because your oral microbiome is changing every 70 to 80 days, you really need to be getting your teeth cleaned 4 times a year. That's every 3 months, to stay on top of that bacteria from really recolonizing in those deep, dark spaces and creating bone loss. So we want to stay on top of that. So twice a year is not good enough for somebody that has periodontal disease. So there is definitely a difference there. I'm sorry.
Is it the fear of the dentist, or is it that the dental insurance just
I was
is
just going to
that
talk about
great?
that.
Yeah.
Yeah. So I think it's both. I think
Okay.
people think that, well, if something goes wrong, I have dental insurance, it'll cover everything. Well, that is a huge mistake because dental insurance is really more like a discount plan. Benefits
Right.
not increased since the 1980s, but the cost of dentistry has skyrocketed. So someone back in 1980, a $2,000 maximum benefit, they could have probably gotten quite a bit of work done for that. Nowadays, it's one tooth, one crown is
Yeah.
$2,000. So if you're somebody that has neglected your mouth and you go to the dentist and you find out now you need a $15,000, $20,000 treatment plan, it can really be overwhelming quickly. So that's why I'm so about prevention. You don't want to find yourself in that situation. You don't want to just say, oh, pull on my teeth. We can amputate, right? We can make you prosthetic limbs. Is it ever the same? So, dentures, I mean, it's a scientific fact. If you have dentures, it actually decreases your lifespan. And again, everything is connected. So we don't want to just amputate. Nothing is going to really replace your teeth like your natural teeth. So I think people have this false mindset of my insurance is going to cover it if something goes wrong, or just pull on my teeth and give me dentures. But that's really a shame. So hopefully empowering people to meet the steps necessary, whether it become more educated or find a dentist that does sedation dentistry so they can work with the anxiety, but make the first step.
So we've covered a lot of things on body, the heart, and other portions, but you also stress the role of oral care and pathways on breathing and airway health. And that's a little bit surprising connection to me and I think to some people. So talk a little bit about that, Heather, and what is all that about?
So nasal breathing is the most important thing that you can really do for your health because that's your primary way of getting nitric oxide. We don't want to be mouth breathing. Mouth breathing is going to create decay. It disrupts the oral microbiome, and it's a sign that your airway is affected. If you're not getting oxygen, pretty serious, right? Sleep apnea is, I think 80% of people are undiagnosed.
Yeah, I'm kind of addicted to oxygen. I need it. I don't know about everyone else, but I need it.
Exactly. So what happens is a lot of times starting from infancy, the facial structure isn't developing properly because that child might be breathing with their mouth open. When a little baby starts with a habit of breathing with the mouth open, what that is going to do structurally is create a more vertical growth of the jaw as opposed to horizontal. We want a wide horizontal jaw because that will open up the airway. A lot of times there can be what's called a posterior tongue tie. In dentistry, we're taught to look for ancleoglossia, which is an anterior tongue tie, but a posterior tongue tie is not something we're actually taught in dental school, which is crazy. It's separate learning. Again, that's why I became a myofunctional therapist to identify these things. So if that tongue is tethered to the floor of the mouth too tightly, what happens is the body will compensate and that the neck will go forward. That can create TMJ problems, neck pain, because the body's naturally trying to get more oxygen and open up that airway. And then when you sleep, right, you're snoring, not resting, not feeling, well rested when you wake up in the morning because your airway is compromised as you sleep with your tongue. So knowing how to evaluate that properly, do some myofunctional therapy, which is basically physical therapy for the tongue, the jaw, the face, to see what we can do to strengthen that and get that tongue to where it belongs. It doesn't belong on the floor of the mouth, it belongs up on the roof of the mouth. But so many people aren't aware that they're either breathing through their mouth or keeping their tongue where it shouldn't go, and they're clenching, they're grinding. They have all of these signs that the airway is constricted, but no one's ever talked to them about it. So they're really clueless on it.
And Heather, what is that therapy called again?
Myofunctional therapy.
Myofunctional. Okay.
Yeah.
And
I have a separate website where I have consultations with people and work with them for that. It's called Myology Wellness.
And that's something that can be done remotely. You don't have to do it in.
Correct. Yeah. It's via Zoom.
What are they that people can find them?
SimplySilverMouthwash.com. I do dental consultations through the services tab on the website there. You can also find my Myology Wellness website through that. In Myology, I spelled it MYOLOGIE wellness.com. So you can reach me through my website. I have email.
So So that website will be, you mentioned, like you mentioned your book, you mentioned the mouthwash, you mentioned you had a separate website for this other item, but they can all be found through your Silver Mouthwash portal.
Yeah, Simply Silver Mouthwash. You should be able to find all of that information.
Excellent.
Anybody we need to hear from this?
Sure. Yeah. So according to independent studies in PubMed.gov, this supplement that I'm going to tell you about has 87 of the 102 trace minerals your body needs just to live. Improves energy, enhances cognitive function, supports healthy aging while boosting your immune system. It's the United States #1 brand of pure Himalayan Shilajit. I like the honey sticks. They taste amazing. And you can find that at BetterAlt or the betteralt.com, GNC and other fine retailers. Also, we have a special on them in the TikTok shop, so you can find them there as well. We'll leave those links in the show notes. So, back to getting to taking this whole discussion home with you, Heather. How should we take care of our mouth on a day-to-day basis?
Well, I would say the first thing that you do in the morning, because your teeth poop, right? Your teeth poop every single day. So
I've never heard that terminology before.
Yeah. So basically, brushing gets off 60% of that poop, but the rest is in the toilet bowl, and that's the space between your tooth and your gum that can only be accessed with manual floss, not the little cheaters. So you want to make sure that as soon as you wake up in the morning, you scrape your tongue with a stainless steel tongue scraper, and you brush your teeth. First thing in the morning, because you're getting rid of all of that poop. Your teeth are organs, they're excreting. That's why your breath smells like poop in the morning.
So you think mine smells like roses in the morning?
Oh, sure.
Of course.
I don't think so.
So you would brush before eating breakfast, or would you brush again after breakfast?
No, because your saliva, a number one mistake people make is they brush their teeth right after they eat. You don't want to do that. You want to wait 30 minutes because your saliva is your natural protectant. Your teeth are constantly being demineralized and remineralized through your saliva. So when you eat, the way that your body is designed is that saliva production is starting to increase the minerals again. You don't want to disrupt that process. So you want to wait 30 minutes at least to brush your teeth after you eat. So first thing in the morning, scrape your tongue and brush your teeth. And then, if you eat breakfast or whatever, as long as you wait 30 minutes, you can brush again, or you can use like a mouthwash that's not going to disrupt your oral microbiome, like Simply Silver. Rinse your mouth out real good. Make sure you brush at least twice a day for 2 minutes with an electric toothbrush, and then use the manual floss.
With a what toothbrush?
Electric. I mean, your hand can't possibly go 5,000 strokes a minute, right? And I don't know about you, but when I use a manual toothbrush, it's a weapon in my hand, and I just scrub too hard. So when you have an electric toothbrush, all you got to do is you got to hold it properly, and that's 45-degree angle at the gum line. You hold it 5 to 10 seconds, and then you pick it up and move it. And you pick it up and move it. You don't drag it all around.
Well, no, if I hold it at the, if I hold it at the gum line, then I'm not getting my full tooth, Heather. Do I not need to bring it up off the gum line, get my full tooth?
You're going to be moving that around. You want to hold it, right? And then you can kind of just sweep up, hold it, and then sweep up, hold it, and just sweep up. And then you do want to do the chewing surface. You can go back and forth on the chewing surface, but everywhere else along the gum line, you want to avoid the long stroke back and forth. That's what's very damaging to the teeth. And
that can cause receding gums, I believe.
It can cause receding gums, but the number one cause of receding gums is airway health. So breathing through the mouth and not having a properly aligned bite is going to create recession. So these are all signs and symptoms of airway health, really. It's not necessarily how hard you brush. It can be toothbrush related, but so many times you'll see one tooth is receded here, one tooth here. I mean, if it were truly a pattern of traumatic brushing, you'd have more consistency where the pattern is. So,
and obviously, as you brush your teeth there, we're going to go with some proper, so we've got you here, some proper toothbrushing, like we just talked a little bit about there about moving it up. Now, I had great, fantastic parents, but my parents never taught me to brush the inside surfaces of my teeth. I just kind of said one day, shouldn't I be brushing the inside surface of my teeth as well? And so should that be done, and why? And you say brush twice. What are we really accomplishing when we're brushing the teeth?
So you're wanting to remove the bacteria, because bacteria forms right where your tooth and your gum meet. So many times people think, well, I'm not brushing my whole tooth. Well, plaque isn't going to be necessarily on the whole tooth, but at the gum line, and you need to be stimulating the gum tissue. So proper brushing is like massaging and stimulating. So it's going to bring blood to the area to heal, right? Because your mouth is the most vascular part of your whole body. So you want to make sure you're brushing properly for the correct amount of time. 30 seconds isn't going to cut it. It needs to be a full 2 minutes, again, with an electric toothbrush. And then I don't like those little cheaters that I call cheaters for flossing, because they only clean in between the teeth. They don't clean out that toilet bowl. You need to.
Well, so I use, hey, quit referring to my mouth as a toilet bowl. How are you getting to me here?
And the crunch is all mouths are toilet bowls.
By those cheaters, you mean what they're like the dental picks that you go on before?
Yeah.
Now, do you say don't? Because my dentist has got me using those. I will admit I had some periodontal disease for a while because I had neglected mine. So I go through a whole care of floss, of the manual flossing, the dental picking, and water flossing, which one I ask you about too. But you're saying don't use those dental picks at all, or you just don't like to use them in isolation without doing the other stuff?
First of all, if you think about it, you're transferring bacteria from one tooth all the way around your whole mouth, right? Mm-hmm. So and it's not even going all the way down underneath the gum. The entire purpose of flossing is to get to the base of the bowl, which you can go down 4 millimeters when you use manual floss. When you use those little cheaters, you go 1 to 2, and it's just in between the teeth. So it gives you the false concept of I floss, but you're not getting to the base of the bowl. You're not cleaning out that bacteria underneath the gum. And people say, well, I don't floss because my gums bleed. That's the worst thing that you can do. Your gums are bleeding because you're not removing the bacteria. It's like exercise. It's going to hurt at first.
And how many times a day do you recommend flossing?
Once a day. I mean, once a day. If you're really good at flossing, once a day. Now, if you are someone that has periodontal disease, I would definitely recommend water flossing as well. But a water pick does not replace manual floss.
Now, what about this? You've educated me so far on the brushing, the flossing, and the dental picking. Now, what about this other craze, which I think you told me I think you adhere to, but I think it's crazy, about this the pulling and what is this pulling, and why should or should it not be done, Heather?
I love oil pulling. In fact, my toothpaste is the only toothpaste on the market that doubles as an oil pull. And I use coconut oil. That's the main ingredient in my toothpaste. What it's doing is it's picking up bacteria throughout the mouth. It's an Ayurvedic thing that's been done for centuries. And it's just a great way of detoxifying the mouth, because again, everything is really right here is where.
So what is pulling for those?
So you put like with my toothpaste, just maybe a teaspoon inside the mouth, let it melt. And then you kind of pull it through your teeth, swish, you pull, like, you know how you pull something directly through the teeth, and you're just really working that through your saliva for about 15 to 20 minutes. It takes that long to kind of pull out the toxins. And then you just want to spit that out. You don't swallow that. But coconut oil is fantastic. It's an anti-inflammatory, naturally whitens teeth. It's, just a good antibacterial product in general. So yeah, I love oil pulling. Some people just don't have the patience for it, the time for it, or they have a lot of TMJ issues where they just can't sleep.
But if I'm using your mouthwash or a good mouthwash, we do want to use yours. But if I'm using a good mouthwash and I'm using a good toothpaste, do I also need to oil pull as well?
Depends on what your root cause is. I mean, if you're somebody that I don't have any issues, I'm pretty healthy, that's pretty much a personal choice. But if you're somebody that really is struggling with gum disease or cavities, and you're just desperate to, find out what is wrong with me, I don't want to have to keep giving my money to the dentist every single time I go, I have a cavity. I would say incorporate oil pulling for sure. It's certainly not going to hurt anything. It's amazing if you give your body what it needs, how it tries to heal itself. So I'm all about using anything natural possible.
Dr. Bob?
Hi, Heather. It's great to see you. Heather, how often do you do that oil pulling?
A couple times a week even. You don't have to do it every day.
Okay. And I use coconut oil as my toothpaste, actually. And I don't know where I came with. Somebody told me that would be a good thing to do. I tried it a while ago, and that's what I use now. And I really like it. It's excellent. But I've never heard about
oil.
An
example of mine, and you can compare.
I would love that. Yeah, I would love that. And also, I've never heard of oil pulling, but it makes so much sense. I mean, oral health is just so important. It's incredible, and people don't realize how important it is. And certain conditions that people have can be directly traced back to, oral ill health. And so it's great that we're talking about this. Thanks.
Agree more.
Yeah. So you do really focus though on that microbiome, right? And that's so anything that you are producing is helping to support that. Your toothpaste, your mouthwash. What are the, I guess, the key things that we need to look for to make sure we're supporting our own personal microbiome?
Well, the whole reason I actually came up with my own line is because I was so frustrated. I even went to a health food store because I wanted to feel comfortable being able to recommend products to my patients. And I was mortified at some of the ingredients I was reading, like I said, even at a health food store. But come to find out, the whole reason they are allowed to put all of these toxic chemicals in your oral care products is because it falls into the category of cosmetics. So that's why they are allowed to do that. So, unfortunately, anything pretty much in, a Walmart and all these other stores are really going to be disrupting your oral microbiome. You want to avoid things that are going to make your mouth more acidic or be abrasive to your enamel. Your enamel does not regrow. You can remineralize enamel, but once your enamel is lost, that's not coming back. So many of our toothpaste out there are so abrasive. It's like brushing with liquid sandpaper. What are you doing to your teeth over time? You're wearing away your enamel. That's
And
not
what are the ramifications of your enamel going away, Heather?
sensitivity, really sensitive teeth, whether it be to cold or to sweet, painful. It can be really painful to have that kind of sensitivity because you no longer have your enamel, which is protecting that root. So my toothpaste is one of the most mild toothpaste out there. Anything over a 70 on the RDA chart of abrasiveness is considered abrasive. Even Sensodyne's between a 72 and a 79. Some of your whitening toothpaste is 150 plus, so it's super abrasive. And you're not going to make your teeth more white. Baking soda is the most mild cleanser you can use. If you're somebody that's getting a lot of stain, use straight baking soda. Don't be using things that have hydrated silica or activated charcoal or bentonite clay in your toothpaste. It's a fad, but it's terrible for your enamel long term. There's zero safety studies on that.
Yeah, that's what my father used as an old military guy. I don't know if he got out of the military or not, but they had to go. They had shortages. I think his deodorant. He would make his deodorant out of baking powder. He would make his toothpaste. He'd make his toothpaste out of baking soda, not baking powder, baking soda for both of those. And that's what he used.
Yeah.
I think a dentist told me that baking soda was very abrasive and not to use it. Is that wrong? I'm hoping it's wrong because I used to use it a lot and I liked it.
Yeah, it's a 7 on the scale of abrasiveness. It's a 7. So
Wow.
That's a misconception. It's a myth that it's damaging to your enamel. It's not true.
And what's that scale go from again, Heather?
Well, basically 0 to 200 plus.
Oh, wow.
So anything over a 70 is kind of considered abrasive.
What's yours?
31 and a 32.
Gotcha.
So you got your difference in your toothpaste.
My spearmint is a 32. My mint and my cinnamon are a 31. Yeah, so very, very mild, safe for all dental work. It's not gonna. There's zero hydrated silica, zero chemicals of any kind. So I just wanted to have something that I felt comfortable lending to people.
Right. And so now tell us also what's the difference in the Simply Silver mouthwash. So what's the difference in that composition?
So I use colloidal silver because it doesn't disrupt the oral microbiome. It only bad bugs and not the good. So it's not something that is going to mess with that wonderful, bacteria that you have in your mouth that is both good and bad. It's only going to kill the bad bugs. So it's not disruptive. It's very alkalining. My spearmint has a pH of over 8. So, it's really great for people that have dry mouth or are cavity prone. The mint and the cinnamon, I geared more towards people that have gum disease because I use something, it's called dragon's blood or rock proton lechleri sap. I know it's a big word, but it's like a liquid Band-Aid. So it really helps people with bleeding issues, gum disease issues. It's got myrrh, tea tree, and clove. So,
there's a lot here, meaning it's back to the pooling portion a little bit. But so we got you brush your teeth twice a day. You got the floss once a day, and you have water flossing too. If we have the great Heather Paul toothpaste, do I need to use the great Heather Paul mouthwash too in that whole combination?
It's Heather the hygienist. I love mouthwash because it's just, in between patients, I'm always wanting to make sure that my breath is fresh. So I have bottles of my mouthwash at my office that I'm constantly using, but it depends on how concerned you are about your oral health, what issues you have going on. I mean, everyone can tailor their routine, but regardless, you have to brush your teeth twice a day for 2 minutes, and you have to floss once a day. That's basically 5 minutes. 5 minutes, right? I mean, I'm not saying someone has to go exercise for an hour a day, but everyone has 5 minutes where they can at least brush their teeth twice a day and floss once a day. Flossing your teeth takes 1 minute and 1 second. So,
well, now with that visual you gave us earlier about your teeth pooping and needing to get that out of your mouth, I think more people are going to brush their teeth more frequently now.
and I would say too, a helpful hint for flossing is keep it in the shower. I feel like that's a good place for it. It's not out of sight, out of mind. You know, if you feel like you fall asleep before you get a chance to do your oral care routine, then do it after you eat dinner. Find a way that is going to incorporate into your lifestyle and be consistent with it. So
now don't forget your tongue scraping though. You said we got tongue
first thing in the morning.
Wow,
And those tongue scrapers, can they just be thrown into the dishwasher? How do you keep them clean?
I have a little ultrasonic unit
Okay.
that I fill up daily, and I have a night guard that I wear. So I clean my night guard and I clean my tongue scraper in my ultrasonic, and I throw a little bit of my mouthwash in there. But that's how I clean mine.
Okay.
Yeah. You can take alcohol or even hydrogen peroxide and wash it off. I'm sure that would be a good way to disinfect it. But yeah, you definitely want to be, changing your toothbrush heads every 3 months. And if you get sick, then throw it away and get another one. Don't reuse it.
Right. Is there one thing that you wish every dentist or hygienist knew that might not be taught in school today? What would that one thing be?
Evaluating airway health. I feel like with 80% of the population having sleep apnea issues, we have such a prime opportunity to be evaluating that and recommending sleep studies. And, if you're not getting that oxygen at night, it's attacks to your cardiovascular system. It can cause heart attacks and strokes and high blood pressure and even IBS, anxiety, depression, all because your body isn't getting into parasympathetic, right? It's in fight or flight all night long when you're not getting enough oxygen or when your mouth is open. So then your body can never get into that rest or digest, which is critical. Your body needs to be able to heal while it's sleeping. And too many times people are not getting that parasympathetic rest that they need because their airway is compromised.
So you've given us a lot of great information and certainly things we can turn and work with you on and get supplied from on you. And you've got your book, we can learn more. But Heather, the hygienist, you can't fly to each one of us and be our dentist and our own personal hygienist on that one. So what help us determine how we should select our local dentist. And now you gave one good tip on that earlier, was say look to make sure they were with a Mercury safe. What else should we be asking?
Yeah, and again, I do talk about all of this in my book, but I would say find a good holistic dentist. Get out of the mindset that insurance is your end all be all, because it's just not. And if you really care about your health and you're somebody that is having some issues and no one is addressing it, find the right provider. You can go online and Google biological or holistic dentist near me. I get it. Sometimes they're few and far between, but we've had people fly in from all parts of the world to have the dentist that I work with do their smile design. So where there's a will, there's a way. It just depends on, how determined you are. And I understand finances. If someone is really not able to pay for dental cleanings, there are dental hygiene schools available where you can go and for very minimal cost, get your whole mouth cleaned. And believe me, it'll be the best cleaning of your life because it's a learning facility. It might take 9 hours, but nonetheless, it is a very affordable way to at least get the cleanings taken care of. And usually every dental office has some sort of a program. We offer a midday special for healthy cleanings. It's $138 for exam, cleaning, and x-rays if you're healthy. But again, if you're staying on top of it, it's so important. I always give the analogy of a vehicle, right? If you never gave your car oil and you didn't go for an oil change every 3 months, chances are you're going to blow that engine. It's an extremely expensive repair that had you been doing the upkeep on your vehicle, you wouldn't be in this position. So, I think we need to stop saying, well, my insurance isn't going to cover this or I can't afford it. You can't afford not to. So, I think changing your mindset about this is really important. I need to find the time. I need to find a way financially where I can do this and stop making excuses.
I love your suggestion about going to the schools, because they are practicing and they're doing their very best job. I was just in preparation for this episode. I was just talking to my family about the very best filling I ever had done and how that tooth just felt so smooth and was perfectly done. And yes, it did take a lot longer than a normal filling, but it was done by somebody who was they were actually passing their board on that particular whatever type of filling I needed. And yeah, it probably took them 3 times as long or 4 times as long as normal, but it was absolutely the perfect filling.
It has to be. They're getting graded on it. So
Yeah. So what kind of feedback do you get from people who have made that switch to a more, natural approach?
I think once people get used to the fact that their toothpaste isn't foaming, that they really enjoy how clean and fresh their mouth feels. And it's really different than the burn. I think, again, we're kind of conditioned to, unless it's burning or unless it's foaming, it's not working. That's not true. Again, we're trying to create a good biome, a healthy symbiosis, not disrupt everything. So just because something's burning doesn't mean that that's good for you. I would say that the people that have stuck to, doing what I have suggested that they do, I mean, I've had people come back and thank me for saving their life because, I discovered that they had cancer and encouraged them to go to the doctor. And I saved their life because, they hadn't gone to the doctor in so long, but I noticed something in the mouth that was just off and said, look, you really need to make an appointment with your primary care. And he had blood cancer.
Wow.
So,
Wow.
Again, it's just like, this is really where everything starts. And if you have someone that knows what they're looking for, could potentially save your life.
Is there one small shift that can be done daily that'll make a big difference? Because you just talked about saving somebody's life, but at home, what's one small shift we can do daily?
Throw out your commercial toothpaste. Stop brushing your teeth with something that's disrupting your oral microbiome. I mean, your teeth are made out of hydroxyapatite crystals, 97%. Okay. Mm-hmm. Fluoride, supposedly what it does is it creates fluorapatite, which is a form of hydroxyapatite, but it's a labeled poison. I mean, that's why it says what it says on the back of the box: harmful to swallow, contact poison control. It's a halogen, it's a mutagen. In a court of law, it has proven, the FDA or the EPA was sued, that it reduces the IQ. So you don't need to poison yourself to get good health. I mean, give your body what it needs. It will naturally try and heal itself. Support your oral microbiome, eat healthy, right? I mean, everything is about what you put into your body. So if you're eating ultra processed foods, that's going to be harmful. But just throw away that tube of commercial toothpaste. Stop using Listerine. Just make one small change at a time. I always tell people, because it can feel overwhelming. Oh my gosh, to be healthy, it's impossible. Make one small change at a time. So that way it's not overwhelming. Stop using commercial bread. Make a switch, just one thing at a time. And then that way it doesn't feel so overwhelming all at once.
Take us through again, if you would, the best ways to, some of the resources that you have available and the best ways to reach out to and get those resources with you, Heather.
You mean like my email or my website?
Whichever makes sense to you, whichever way you want people to contact you and interact and find out where to get your book, get your toothpaste, and all those things. Yeah.
They can order my book probably on Amazon. That's the best place to get it. My book is called Dentistry Made Easy. I think this is it right here. Dentistry Made Easy, the consumer's guide to oral health and smart decisions. So I would say get the book off of Amazon. You can set up a consultation with me via my website. My email is heather@simplysilvermouthwash.com. So, I am available to people. My dental consultations are only $50. I try to make it affordable for people. I try to give people the resources that they need because I do care. I am passionate about, getting the word out. That's why I wrote the book. I'm just so tired of, of hearing the same things over and over and over again. And I really hope that people start looking at their mouth, at their teeth differently.
It's just incredible to me that the subject here is so important. And if I look around at our society, what percentage of people are not doing, I'm going to say your way is the right way. Let me just say that. How many people are not doing it the right way? It's like 99%. I mean, it's an enormous number of people who are not really taking care of themselves well. And
exactly. And when they say, well, my gums have always bled. Well, That's not normal.
There's a reason for that. Yeah. Oh yeah. So I think it's really great that you're putting this out there, and I hope your toothpaste sales go crazy, because that's like the easiest, simplest thing that'll make the biggest difference, in my opinion.
Right.
Toothpaste and make it happen for people's health. It's just great. Thanks.
Really.
Along those lines, one last question from me. Now, and you make your consultations affordable for folks. Where would you put the cost of your mouthwash and the cost of your toothpaste on the spectrum?
I really think it's affordable, because a little bit goes such a long way. I mean, there's 80 servings in my mouthwash because it's so medicinal, it's so strong. A little bit goes a long way. That, again, a pea-sized amount of the toothpaste. So my toothpaste is like, I don't know, $12.99 to $13.99. The mouthwash is around $15, $16, just depending on where you buy it. But if you subscribe and save on my website, I have monthly discounts that I give if you sign up on my email list. So I'm always I actually should charge more because I'm really not profitable, but I just so badly want to make things affordable for people because, I was a homeschooling mom. We struggled financially. I get it. That's why I made everything from scratch. And when I say everything, I mean everything. I make my own skincare. I make my own deodorant. I made my own salad dressing, bread, everything. My girls are great. They're both married and on their own. They know how to make everything from scratch too. But, I understand you need to save where you can, but I think there are certain things that you should spend money on because it can just benefit you in so many ways.
One thing we learned from our backstory with you, Heather, is that you also are donating. You have a lot of your the proceeds from the sales of your mouthwash and toothpaste are going to help charities. So tell us just a quick bit about that for those that didn't listen to the backstory yet.
There's currently 2 charities that I donate to. One is called Bless an Orphan, and they're based out of Peru. They do have some other locations in Ecuador as well. A lot of sex trafficked children, abused children, horrible situations. So we donate there. And then also in Uganda, there is an orphanage called Let Children Live, and we help them out as well. And eventually, I really want to just be able to help more people here, even in the United States. There's so many things that I would really love to do to help people out. I want to offer like a free whole mouth giveaway, where we can register and then restore that person's mouth. I'm working, in fact, Dr. Brennan, who wrote the foreword for my book, we are trying to work together something where we can offer a giveaway, and people can send in pictures and write their story, and we're going to pick one and completely restore that person's mouth. So these are the kinds of things that I really want to do. But, again, it's all about finances. And as the Lord blesses us, we want to bless others.
Well, thank you for that service. And I would invite you and our listeners to please join the WellWaveNOW Facebook group. We'll put that link in the chat as well. And that might be a great place for you to promote not only your products, but then that service that you're going to provide, because that's a great group there that's always looking for help and assistance. And so, please join the WellWaveNOW Healthcare Disruptors Facebook group. You can find us there, and we invite all of our listeners to join that group as well. But it has been absolutely fantastic to have you on the show today. A great big thank you to Heather, the hygienist, and for sharing your expertise with us today. I learned so much. There is a very vivid picture now that I will brush my teeth first thing in the morning now when I get up. I usually wait until after I eat, but you've told me, we're doing it backwards. So I'm going to do that first thing in the morning, even before I eat. And then, of course, wait for 15, 20 minutes after you eat so that your natural saliva can do its job. 30 minutes. Okay, I've got that now. Man, for somebody on a tight schedule, you might have to get up a little earlier, right? You're trying to hurry and get on to your off to work or to your next Zoom meeting. But until next time, everyone, stay curious, stay empowered, and remember, wellness, it's in you.